Well, arthritis is the most common cause of disability in Canada. The pain is being felt financially as well. A new report by the Arthritis Alliance of Canada is out today, and it says arthritis costs the economy $33 billion last year alone. And it says the costs come directly from healthcare costs as well as indirectly from lost production. Well, here to discuss the findings in this report is our medical expert, Dr. Karl Kabasele. $33 billion a year. Is that a wake-up call, or should we look at this with some, is there something that we should be looking at in this study? Take it with a grain of salt, let's say.
Well, these estimates are always difficult to sort of say for sure, but it does stand to reason. This is a very common condition. According to their stats, 1 in 8 people have osteoarthritis, 1 in 100 have rheumatoid arthritis. Obviously, it's a cause of disabling pain and reduction in function. So what they're basically saying is we need a national strategy. We need to put the resources forward towards this problem because it probably will only grow as our population gets older.
Okay. Why is arthritis on the rise?
Well, part of it is because of aging. As people get older, your risk of arthritis increases simply because of wear and tear. So osteoarthritis is the most common form, and that's where the tissues in the joints, the cartilage generally that lines the bone, starts to break down. That can cause pain, it can cause locking up of the joint, etc. Now, the other sort of interesting connection, though, is with our problem with obesity. So particularly for the joints in the lower body, which support your body weight, with every step you take, you're impacting the joints. So they're also arguing that we should be addressing the obesity issue. And they're obviously not the only ones to say that, because if we address obesity, we also address heart disease and some cancers. And there's so many benefits, if you will, to addressing obesity.
Okay, so is it just obesity, or is there a way to prevent? I mean, let's say I'm not obese, I'm not underweight, but I'm not overweight, terribly overweight either.
Okay.
So how would I go about preventing getting arthritis for the rest of my life?
Well, that's interesting. I mean, again, let's start with rheumatoid arthritis. That's an inflammatory condition. There tends to be some genetic component to that. It's not something that you can necessarily prevent, except that for certain people, smoking can increase the risk of rheumatoid arthritis. So don't smoke. We all know about that. Now, when it comes to osteoarthritis, again, it's a question of wear and tear. Oftentimes with people who are professional or elite athletes, you see injuries that can lead to osteoarthritis. So you want to, sort of take it easy. I know there are a lot of people, for example, who like to go running, which can be, quite hard on the body in so many different ways. So if you are a runner, think about the surface you run on. You don't want to be running on concrete, etc. But it can be difficult, aside from losing weight and using your body sort of in a reasonable fashion. It can be hard to prevent this this disease.
All right, which is why we're seeing the numbers increase.
Yeah.
All right, and I wasn't just tapping you up for free advice. Thank you.
Thank you.
Okay, CBC medical specialist Dr. Karl Kabasele. Well, the sad legacy of the residential